Hello, I'm Jackie West. Welcome to Political Empire. Today we're talking about supervisors in D.C. and less for lobbyists. First up, Riverside and San Bernardino County supervisors gathered in Washington, D.C. this week for a national conference on county government issues. While there, they had breakfast at a D.C. lobbying firm. The purpose of this publicly noticed breakfast meeting was to discuss issues of mutual interest with members of the Inland Congressional Delegation. Next up, less for lobbyists. Riverside County is cutting back the amount of taxpayer money spent on lobbyists in Sacramento and Washington. Here to discuss the cutbacks is reporter Jeff Horseman. Welcome, Jeff. Can you tell us why the supervisors are spending less for lobbying activity?
Sure. Well, a large part of it has to do with just the fact they have less money for everything, and so it's natural that they'd look to cut back on their lobbying as well. But there is also, it seems as though there's been kind of a frustration on the part of at least some of the supervisors, particularly with the state lobbying team. They feel they haven't been communicative enough. They feel like they haven't gotten enough updates. And so, along with the just cutting back on the amount of money, they also kind of reorganized how the lobbyists work in hopes of getting some more effective teamwork and coordination with them.
Okay. Now, do we know some of the big issues in Sacramento that the county is focused on?
Absolutely. I'd say a couple of the biggest ones. One continues to be the impact of realignment. This is the shifting of responsibility for low-level offenders and other public safety services from the state to the counties. Riverside County wants to make sure that there's just enough money for them to do that, and they're also concerned about the prospect of inmates serving years, very long jail sentences in county jails, which really aren't equipped to handle inmates like that. And another big one is healthcare reform. In 2014, you're going to see a lot more people eligible for Medi-Cal. That's the state's insurance program for the poor, and the county has a hospital and health clinics designed to cater to maybe the more needy in the population, and so they want to make sure whatever comes out of that, again, that there's money for it, that it's not an unfunded mandate, and that the county is able to handle it responsibly. All
right, thanks for joining us, Jeff. Appreciate it. That does it for Political Empire. I'm Jackie West. We'll see you next time.